Nicole. I'm going to be showing you guys how to do a blood glucose specimen collection today. First, I'm going to walk in and introduce myself to my patient. How are you today? My name's Nicole and I'm going to be your nurse. Can I just have your full name and date of birth, please? Thank you, Mr. Brody, and that does match up with both your wristband and your MAR. So what I'm going to do before we get started, I'm going to take your blood glucose level. We're just going to do a small little finger prick on your finger, okay? And then that should give us our number. I'm just going to wash my hands first. Alright, and then after performing hand hygiene, I'm going to don gloves. And then what I'm going to do is I'm going to assess my patient and make sure that they don't have any kind of swelling, any kind of injuries, anything like that on the finger that we're going to be choosing. So I look at my patient's fingers. He doesn't have any kind of abnormalities, anything that would deter me from sticking his finger. I'm going to make sure it's nice and warm. There's lots of blood flow to the area, but we don't want to milk the finger and have the chance of hemolyzing the sample. So what we're going to do is we gather our supplies. We're going to just check the expiration date on the blood glucose test strips, make sure they're the right one for the machine that we're using. Then we're going to get an alcohol swab. And we're going to start by cleaning the patient's finger. And we're going to allow that to air dry because you don't want to go sticking them with a needle with wet alcohol on their hands. So then what we'll do is we'll get our lancet and we're going to just twist off this white part here. What we'll do is we'll push it up against our patient, wait for the click. And then as we obtain our sample, we're going to get our strip ready, put it into the machine. You'll hear it beep. And when you see the blood symbol, you'll go ahead and it'll suck that droplet right up. And we'll place that there, clean up my patient here, and we'll bandage his finger up. And I'm just going to tell him to apply some pressure. Always make sure your lancet goes into a sharp box. And then I see here, Mr. Brody, that your blood sugar is within the normal limits of 70 to 110. And then what I'll do is I'll document my patient's blood glucose level in his chart, document that he tolerated the procedure well. I'm going to remove my gloves, clean everything up after, and perform hand hygiene. And that's that.